You were instructed to watch a short prep video that prepared your page 35 to have two little flip windows. If you haven't done that, stop, get prepared, and then come back. At this point, I would like us to skip to page 35 where we have our little flip chart, and then we'll come back. To get ourselves set on this, we need to label a few things. While the sympathetic division has an origin in lateral horns of T1 to L2, we are going to say that this is level T1. And with level T1, we are going to say that this is our dorsal horn, this is our lateral horn, and then this would be our ventral horn. On this drawing, I am going to represent 4 different functional classifications of neuron. In blue, I am going to be drawing the GSA neurons. In red, I am going to be doing the GSE neurons. It's supposed to be red. In green, I'm going to be doing the GVA neurons. And then in purple is going to be the GVE neurons. And because I'm specifically focusing on the sympathetic division because of my spinal levels, I'm going to represent my preganglionic as a solid line, and a dashed line is going to be my postganglionic neuron. That gets me started. We know that GVE is motor to cardiac and smooth muscle and our glands. Yes? GVA is going to be sensory back from any of those types of structures. Okay? So sensory from organs and glands. GSE is going to be motor to skeletal muscle. I really wish my red would look like red when I had it on my camera. And then GSA is going to be sensory. We're going to say from skin for right now. Yes, it's going to be from our joint proprioception as well, but skin is what we've focused most of our attention on. So to draw those in there is I would have, coming from any level really, coming from my skin, I would draw neuron coming through my dorsal root, draw my cell body, and then have my axon going in my dorsal horn. Yes? And we know that that signal is going back to the brain. I can have sensory coming from organs coming in and following the same path through the dorsal root because it's a sensory, and there's its cell body, and it's going to come and it's going to synapse in the dorsal horn. So all of my sensory stuff is going to run through my dorsal root to get to my dorsal horn. My GSE, please mimic where I'm drawing that neuron over to the left-hand side of my ventral horn. And I want you to draw your axon so that it's kind of hugging. It's going to come through, and it's going to go through the ventral root, and it's going to go out to skeletal muscle. And it can go this way too, for that matter. And I guess, for that matter, we could have a green one coming from organs and connecting to our green one. Doesn't matter. Dorsal ramus, ventral ramus, doesn't make a difference. Now we get to the GVE sympathetic. This is the crazy one. With the crazy one, we are going to have our preganglionic sympathetic neuron is going to start in the lateral horn. The preganglionic neuron is going to go out the ventral root just like the red one does. However, it is going to leave the spinal nerve, and it's going to go into the sympathetic chain. Is the sympathetic trunk. Sympathetic trunk. It's also called the sympathetic chain. I don't care which one you call it, but that's the sympathetic trunk. It's running straight up and down. Sympathetics are the fight or flight part of the autonomic nervous system, which means it has to be able to get to the whole body. There's 3 things that can happen. The 3 things that can happen is we can, in this sympathetic chain, we can synapse right there, and then our postganglionic is going to rejoin, and it's going to go to cardiac or smooth muscle. So it's going to enter the sympathetic chain, and it's going to come out at the same level to get to the cardiac or smooth muscle that it needs to go to. So up here, I'm going to say synapse of a pre-ganglionic sympathetic neuron can happen in 3 ways. Way number 1, in the sympathetic chain, so I'm going to abbreviate sympathetic chain at the same level it entered. That's number 1. But it only goes from T1 to L2. Isn't there parts above T1 that need to be able to respond to stress? Yeah, I think so. Are there areas in my abdomen and down in my lower extremities that need to respond to stress? Yes. So what we have to do is this is situation number 1. Flip the page up, and in situation number 2 is, here is my preganglionic sympathetic neuron. I'm continuing it. It is coming out, and it's going to still enter the sympathetic chain. But now it can go up to supply the superior portions of the body, or it can go down to supply the inferior portions of the body. But in either case, we're going to draw it here, and we're going to go up, which would be C8. And up here is where there will be a neuron waiting for us. And then I draw my dotted line out, and it's going to then go to my cardiac or smooth muscle or my glands at a different level. That is option number 2. In the sympathetic chain, so the synapse, remember that's what we're talking about, in the sympathetic chain at a higher or lower level. So that's going to take care of above our shoulders and below our rib cage. But then there's one more option that happens. Option number 3. Option number 3, I think, are the most rebellious of the 3. Number 3 is that your preganglionic neuron does, in fact, enter the sympathetic chain as it's told, and then it says, peace out. I am leaving the sympathetic chain because I don't want to synapse anywhere in the chain. I'm just going to leave because I know that there's a ganglion somewhere else for me outside of the sympathetic chain. This ganglion is either going to be found in the abdomen or pelvis. And when we have a preganglionic sympathetic neuron that says, peace out, sympathetic chain, I don't want anything to do with you, we call that preganglionic nerve then, we call it a splanchnic nerve. Splanchnic nerve. And whenever you see the word splanchnic nerve, you know that it still has preganglionic neuron axons in it. Once it reaches its ganglion in the region of choice, then we've got our postganglionic, which then goes to the target, which is going to be smooth muscle and glands. So option number 3 is going to be preganglionic neurons enter the sympathetic chain, but exit to synapse in ganglion found in abdomen or pelvis. Because of these 3 different options, this is how we get sympathetic function to the entirety of our body. Even though they only originate T1 to L2, it is because of the sympathetic chain and these crazy splanchnics that we're allowed to get the whole body to respond to a stressful situation. Okay? If you flip back then to page 27, page 27 shows you shows you the different levels now. In this picture up here, here's my preganglionic sympathetic neuron, and you see it entering the sympathetic chain through the rami communicans, and it's going to exit at the same level, and it's going to go to its targets, which would be erector pili, remember that smooth muscle, and sweat glands, and then to all of our walls of our blood vessels. Our blood vessels need to dilate or constrict depending on what the needs are of the sympathetic system, and so that's what they're going to be controlling. Okay, so that's option one. Option number two is let's go out as a preganglionic, enter the sympathetic chain, and look, just like in our picture, it went up to a different level and then is going to leave to go to the same types of effectors, just in a different part of the body. Option number three, we come out of the lateral horn through the ventral root, enter the sympathetic chain, saying, peace out, sympathetic chain, and this splanchnic nerve that we see is just preganglionic neurons that are going to this other ganglion, synapsing, and then going to smooth muscle wall of the intestine. Here is another version of it, showing you how we can go to different levels. Sometimes these different levels are going out the ventral rami to go out to the periphery, whereas on this side, we show it going out. They're synapsing, but they're going down and actually going to the heart. So these guys out here going out the ventral rami, going away from the spinal column, or ending up in the extremities, like in our blood vessels, whereas these guys are specific ones that go to the heart itself. The sympathetic splanchnic nerves, so they're going to come out, synapse later here, and go to the viscera. Now here's a different kind, which I'm not really so worried about, but these preganglionics here, they're going to end up going right to the adrenal gland, and the adrenal gland is going to respond to that. And then here is just another version of the sympathetics. Sympathetics starting here, coming out the ventral root, going into the sympathetic chain. We can synapse here, send our postganglionic at the same level. We can go to a different level and synapse and then come out, or we can come down lower and come out, or bypass and go to this ganglion to there. So again, just another version of the sympathetics. Now I want you to go to page 37, which is going to be our parasympathetic division. And with our parasympathetic division, we still have GSAs, and we still have GSEs, and we still have GVAs, and this time our GVE is our parasympathetic. And again, I'm going to use a solid line to represent my preganglionic neurons, and then I'm going to use my dotted line to show my postganglionic. And much like before, if I want to draw my GSA neuron, there it is with its cell body, and its axon goes out to skin, bringing pain, temperature, and pressure back to the spinal cord. We are also going to have neurons that are going to be bringing sensations back from organs, right? They're sensory. I know that because they're going through the dorsal root. I've got my GSE motor, which are going to go out to find skeletal muscle somewhere. And then finally, the purpose of this, in S2 through S4, and it doesn't matter which level that we're at, somewhere between S2 to S4, we're going to have our preganglionic neuron in the lateral horn, the cell body, and the axon's going to travel through the ventral root because all motor does. And it's going to join the spinal nerve, but in joining the spinal nerve, it ignores the sympathetic chain, it ignores the dorsal ramus, and instead, it is going to leave the spinal nerve And when it leaves the spinal nerve, it is coming down to synapse, giving off a very short postganglionic neuron. Why? Where is this ganglion located? This ganglion, it is in the target organ's wall. These nerves are called pelvic splanchnics. Because what does splanchnic tell us again? Splanchnic tells us that we have a preganglionic neuron traveling through. It has not synapsed yet. And it's not going to synapse until it gets to the organ that it's supposed to talk to. And its ganglion is going to be in the smooth muscle wall. All abdominal organ walls is where those ganglion are going to be located to make that synapse. So parasympathetic neurons, remember I said that the preganglionic was super long? Well, it's got to go from the spinal cord all the way to whatever organ that it's getting to. And then the postganglionic took it really, really short. Because they don't have to go far because, well, really, they're already there. Whereas in any of our sympathetic neuron cases, comparatively, the preganglionic is short because the sympathetic chain is right outside of the spinal column, the vertebral column. And then your postganglionic has to essentially go from the midline of your trunk to wherever the organ is, whether it be smooth muscle or cardiac muscle or glands, in order to send the final signal to. Almost done, kids. Coming back to page 33, 33 shows you the 4 cranial nerves, cranial nerve 3, 7, 9, and 10, which are going to be our 4 cranial nerves that have parasympathetic function. Is that the only thing they do? No, they've got other things happening with them too. That's why they're all called mixed nerves. Down here at the bottom, you've got your pelvic splanchnic nerves that are coming out of S2 through S4, and you can see where their targets are. They are going out to some of the large intestine, going to the ureter of the kidney and the bladder, and then some of the reproductive structures. Okay, so that finishes up the autonomic nervous system, how we are going to get the fight or flight with the sympathetics and the rest and digest components of the nervous system to communicate with the organs that they control. I know that was long. I appreciate your patience and staying tuned in. I really hope that this was helpful. Thank you for watching.